Hi, and welcome to another edition of CNC News Quiz Eye on Alcohol. We're going to be talking about treatment for alcohol problems, finding and getting help. Treatment for alcohol problems, finding and getting help. And this booklet that I'm looking at is produced by the National Institute of Health. Inside that, the National Institute on Alcohol Abuse and Alcoholism. So the guide was originally written for individuals and their family and friends who are looking for options to address alcohol problems. It is intended as a resource to understand what treatment choices are available and what to consider when selecting among them. So let's take a look at this. We're not going to read the entire book. You can find it online. Treatment for Alcohol Problems, Finding and Getting Help from the National Institute of Health. So let's go take a look what they got. First of all, when is it time for treatment? Well, alcohol-related problems, which result from drinking too much, alcohol too much, too fast, or too often, are among the most significant public health issues in the United States right now, and all three of them are related to alcohol. Many people struggle with controlling their drinking of alcohol at some time in their lives. More than 14 million adults, 14 million out of our entire population, ages 18 and older, have alcohol use disorder. And 1 in 10 children live in a home with a parent who has a drinking problem, who has a problem with alcohol. Now, does treatment work? Fair question. The good news is that no matter how severe the problem may seem, most people with AUD, that is alcohol use disorder, can benefit from some form of treatment. There's something out there for everybody. Research shows that about 1/3 of the people who are treated for alcohol problems have no further symptoms 1 year later. That's 1/3. Out of that 14 million, that's about 4 million, right? 5 million? About 5 million people, if they all got treatment. So many others substantially reduce their drinking of alcohol and report fewer alcohol-related problems as they move on their way, hopefully, right? So let's take a look at signs of alcohol problem. What are signs of an alcohol problem? Alcohol use disorder is a medical condition that doctors diagnose when a patient's drinking of alcohol causes distress or harm to themselves and or others. The condition can range from mild to severe and is diagnosed when a patient answers yes to two or more of the following questions. 2 or more. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11. Someone answers 2 yes, then they're dealing with an alcohol use problem, an alcohol use disorder. So let's take a look at them. Let's see. In the past year, have you had times when you ended up drinking more or longer than you intended? Even at a party, even if it was, all in good fun. Has that happened? Had you had times ended up drinking more or longer than you intended? More than once this year. Have you wanted to cut down or stop drinking or tried to but couldn't? Even if you thought about it and then forgot about it? How about spent a lot of time drinking alcohol or being sick or getting over the after effects? So that's a lot of things. And any one of those are going to give you a yes. Experience the craving. Have you experienced a strong need or urge to drink alcohol in the past year? Have you found that drinking or being sick from drinking alcohol often interfered with taking care of your home or family or yourself or caused job troubles or school problems? Have you continued to drink even though it was causing trouble with your family or friends? So you just continued and said, well, that was the problem and moved on from there and picked up with the alcohol? Have you given up or cut back on activities that were important or interesting to you or gave you pleasure in order to drink alcohol? Did you opt to drink alcohol when you wanted to go do something else, when you normally would have done something else that required some activity or motion, and you opted for the alcohol the past year? Has that happened? More than once, have you gotten into situations while or after drinking alcohol that increased your chances of getting hurt? This includes driving while drunk, swimming, using machinery, walking in a dangerous area, or having unsafe sex. Has that happened in the past year with alcohol involved? Have you continued to drink even though it's making you feel depressed or anxious or adding to another health problem? Or after having had a memory blackout? Have you had a memory blackout and then you just, that happens. Well, it doesn't just happen. It happens as a result of drinking alcohol. So have you had to drink much more than you once did? Are you drinking more than once did? If you're drinking alcohol, do you drink more than you did when you started in order to get the effect that you want, or found that your usual number of drinks had much less effect than before, even sometimes? Have you found that when the effects of alcohol were wearing off, you had withdrawal symptoms such as trouble sleeping? Now, withdrawal symptoms, listen to these withdrawal symptoms. You had trouble sleeping after drinking a lot? Shakiness? Irritability that night or the day after or a couple of days later? Anxiety? Depression? Restlessness? Nausea? Sweating? Or sense things that were not there? Well, if you've got any of those symptoms, especially if you've got two more, your drinking of alcohol may already be a cause for concern. And the more symptoms you have, the more urgent the need for change. That change should happen immediately. A health professional, a doctor, can conduct a formal assessment of your symptoms to see if AUD is present. For an online assessment of your own, go to rethinkingdrinking.niaaa.nih.gov. Let's see if I can show this to you here. There it is down there. It's kind of hard to see. I'll put it in the remarks in the video. That's rethinkingdrinking.niaaa.nih.gov to take an online assessment. So there's options for treatment. There's ways to get out of that hole, my friend. When asked how alcohol problems are treated, people commonly think of 12-step programs or 28-day inpatient rehab, but may have difficulty naming other options. In fact, there are a variety of treatment methods currently available, thanks to significant advances in the field over the past 60 years. Just think about that. There is a field dedicated to solving people having problems with alcohol. And that says a lot. Types of treatment. There's behavioral treatment. Behavioral treatments are aimed at changing drinking alcohol behavior through counseling. They're led by health professionals and supported by studies showing that they can and are beneficial. There's medications also. These medications are currently approved in the United States to help people stop or reduce their drinking of alcohol and prevent a relapse, taking it up again. They are prescribed by a primary care physician or other health professional and may be used alone or in combination with counseling. Counseling is a good thing. Then there's also mutual support groups. Alcoholics Anonymous and other 12-step programs provide peer support for people quitting or cutting back on their drinking. Combined with treatment led by health professionals, mutual support groups can offer a valuable added layer of support. And then due to the anonymous nature of mutual support groups, it's difficult for researchers to determine their success rates compared with those led by health professionals, but we have word of mouth and direct observation to tell us that they do work for some folks. So starting with your primary care doctor, first, anyone thinking about treatment, talk to your primary care physician. That's an important step. He or she can be a good source for treatment referrals and medications. A primary care physician can also evaluate a person's alcohol drinking pattern, help craft a treatment plan, evaluate the overall health, which is important because alcohol impacts it negatively, and assess if medications for alcohol may be appropriate. Then there's a chart here for types of professionals involved in care, and I'll let you look at that online. Medication. Some are surprised to learn that there are medications on the market approved to treat alcohol dependence. The newer types of these medications work by offsetting changes in the brain caused by alcohol use disorder. All approved medications are non-addictive and can be used alone or in combination with other forms of treatment, and you can learn more about those. Now, in behavioral treatments, also known as alcohol counseling, behavioral treatments involve working with a health professional to identify and help change the behaviors that lead to heavy drinking. Behavioral treatments share certain features which can include developing the skills needed to stop or reduce drinking, helping to build strong social support system, working to set reachable goals, coping with or avoiding the triggers that might cause relapse and have a person go back to drinking. And there is different types of behavioral treatment. There's cognitive behavioral therapy, which is one-on-one with a therapist in small groups. There's motivational enhancement therapy. It's conducted over a short period of time to build and strengthen motivation to change the alcohol drinking behavior. There's marital and family counseling. Incorporates spouses and other family members in the treatment process and can play an important role in repairing and improving family relationships damaged by alcohol. These are very serious implications against alcohol, aren't they? So brief interventions are short one-on-one or small group counseling sessions that are time limited. The counselor provides information about the individual's drinking pattern and potential risks. And after the client receives personalized feedback, the counselor will work with him or her to set goals and provide ideas for helping to make a change. And ultimately, choosing to get treatment may be more important than the approach used. as long as the approach avoids heavy confrontation and incorporates empathy, motivational support, and a focus on changing drinking alcohol behavior. So there are current medications available: naltrexone, acamprosate, disulfiram, and you can read all about those when you go online. But I wanted to bring up this question: Isn't taking medications just trading one addiction for another? No, it's not. This is not an uncommon concern, but the short answer is no. All medications approved for treating alcohol dependence are non-addictive. These medicines are designed to help manage a chronic disease, just as someone might take drugs to keep their asthma or diabetes in check. Okay, and let me take a little bit more here. The importance of persistence. Persistence. You can persist. Overcoming alcohol use disorder is an ongoing process, one which can include setbacks. The importance of persistence. Because AUD can be a chronic relapsing disease, persistence is key. It is rare that someone would go to treatment once and never drink again. More often, people must repeatedly try to quit or cut back, experience recurrences, learn from them, and then keep trying. For many, continued follow-up with a treatment provider is critical to overcome problem alcohol drinking. Alcohol is a big problem, right? This is impacting someone. If we're just talking about this one person, look at that. That's really getting inside their life there. Not cool. So mental health issues and alcohol use disorder, depression and anxiety often go hand in hand with heavy drinking. Studies show that people who are alcohol dependent are 2 to 3 times as likely to suffer from major depression or anxiety over their lifetime. When addressing drinking problems, it's important to also seek treatment for any accompanying medical and mental health issues. It's time to get happy. Alcohol's not doing it. Alcohol's making it worse. It's time to regain oneself. Happiness is not the only thing we're looking for. There's self-satisfaction in life. There's personal self-worth, and you are worthy. So here's some advice for friends and family. And then we're going to wrap up this little brief video for today. Caring for a person who has problems with alcohol can be very stressful. It's important that as you try to help your loved one, you find a way to take care of yourself as well, because it's stressful. It may help to seek support from others yourself, including friends, family, community, and support groups. There are support groups for people who are supporting people who are stopping to drink alcohol, and you can join them. If you're developing your own symptoms of depression or anxiety, think about seeking professional help for yourself. It's okay. It's there. Go do it. Get it. Remember that your loved one is ultimately responsible for managing his or her own illness. You got to take care of you. If you want to take care of someone else, take care of you. However, your participation can and does make a big difference. Based on clinical experience, many health providers believe that support from friends and family members is important in overcoming alcohol use problems. But friends and family may feel unsure about how to best provide the support needed, especially if they're drinking alcohol. Okay. The groups for families and friends are listed in the information you'll see online. Remember that changing deep habits, and alcohol is a deep habit. It is a physical addiction. The body is demanding the alcohol until you release it and the body changes its incorporation patterns, and your mind changes the way it behaves and the way you think. So try to be patient. Overcoming the disorder is not easy or quick for them or for you. Pay attention to your loved one when he or she is doing better or simply making an effort. Too often we're so angry or discouraged that we take it for granted when things are going better. A word of appreciation or acknowledgement of a success can go a long way. Even a sigh of relief can be heard and felt in the heart. And as I said, that finishes up for us with this one here. And what we were doing was going through treatment for alcohol problems, finding and getting help for alcohol drinking problems, provided by the National Institute on Alcohol Abuse and Alcoholism. Again, that's treatment for alcohol problems, finding and getting help. There you go. Thanks for joining us.